Hi everybody, and welcome to another edition of Alaska Health and Fitness Magazine. I'm your host, Tim Baxter, and for the next half hour, we've got some very important information to share with you, especially if you or someone you know suffers with varicose veins. Dr. Ty Bell will be joining us in just a moment to tell us that it's easier than ever to rid your legs of those pesky veins. Coming up a little later in the program, you'll meet Alaska's sleep doctor, Dr. John Kralik. If you or your sleep partner snore or have other sleep issues, you'll learn how easy it is to find out what's wrong and get it corrected. So let's get started with a visit to the Jordan Creek Center in Juneau, the offices of Vein Specialists of Alaska. We caught up with Dr. Ty Bell recently, and he told us some of the symptoms that go along with varicose veins.
The first symptoms generally are heavy and tired sensations, and it tends to progress as the day progresses. And they may not make much of it until one day they start to realize that's not so normal. They can ache, throb, sting, burn, itch. Restless leg syndrome is very strongly correlated with venous disease. So it comes in wide varieties as to what they complain about, but I would say heavy and tired feelings is probably the most common, and achiness. Many patients think there aren't many options other than the old traditional stripping surgery, which is really passé. Stripping was replaced slowly in the early 2000s, and by around 2005, the consensus was among surgeons that stripping was an inferior procedure, and the new endovenous thermal techniques, which involve laser or radiofrequency, were better procedures.
So a lot of patients are not sure how they know that they have vein disease. It could be multiple things. It could be some restless leg syndrome. It could be swelling in the legs, progresses throughout the day. It could be itching of the legs. You're not sure, you feel like you can get it, but you can't. They could be painful. You could have the bulging veins.
Hi, I'm Dr. Ty Bell with Vein Specialist of Alaska, reminding you that if you have varicose veins, we can help.
About 6 or 7 years ago, I had a small scab that showed up on my leg, and I didn't know what it was from, but it wouldn't go away, and it was really painful. So I went to a series of doctors, and they told me, well, it could be this, it could be that, and then I finally went to a specialist, and they told me that it was a deep vein issue, that I had a venous stasis ulcer that had grown on my left lower leg, on my inner leg, and so I went and had an operation, kind of like the ones that they did here, but unfortunately it didn't have the same results. I struggled for many years with a lot of pain because of this, going to wound care. I worked out of town for a while, so that was pretty difficult with the self-maintaining of it myself. And then through going to wound care again, they actually recommended this office and Dr. Bell and Dr. Smith, and I came in and I've had 7 operations since then and some really good results. I'm really happy with them, actually. They did a really great job. So
your situation was a lot more involved than many.
Oh yeah. It's been a long time, man. This has been a huge road that I've been on, and I'm just glad to see that it finally seems like it's coming to an end.
And everyone was very professional, very friendly, just put you right at ease and talk through the whole process and how it would work. So it was very comforting to know that everything was laid out. There was no surprises. Dr. Bell and his staff were very, like I said, they're very comforting. It feels like you're home here. And so during the procedure, Dr. Bell made it clear that if there's at any time, if you feel any uncomfortable, if you're uncomfortable, or if you feel any pain at all, let him know and he will fix it right away. So you don't have to go through that when you're having the procedures done.
On procedure days, one of my jobs is helping the patients feel comfortable. When they come in and they're nervous or they're anxious, we try to make it comfortable for them. We can let them choose music, we talk to them, we talk about their favorite things, and just talk about what they did for the day to help them relax.
We're successful because we like to treat you like we want to be treated. And when you walk in, we want you to feel at home. It's a pretty light and casual atmosphere. I like to joke around with patients and staff, and I think they realize that we have fun, and we generally do. We like what we do. I joke that I do the same thing over and over again, but what makes it fun for me is meeting new people And, they have the same vein problems, more or less. I mean, it varies patient to patient, but I'm seeing the same things over and over again every day. And that's comforting because I get very good at dealing with the same thing over and over again, but I also get to know them as a person, and my staff does as well. So when patients call, they usually can put a face to a name, and that's nice all the way around.
I will highly recommend Vein Specialists of Alaska to go to take care of your legs, your veins, the issues that you're having. I think Dr. Bell would do a great job for you.
For anyone who was experiencing anything like my kind of pain that I was feeling in my legs, I would recommend coming to see Dr. Bell at the Vein Specialists of Alaska.
I love my dad, and you will too. Call today.
Hi, I'm Shauna with Vein Specialists of Alaska, and I'm the practice manager. I get asked a lot what makes us unique to other practices, and I think that we treat our patients like family. So they come in as a patient, but they leave feeling like they're part of our VSA family. So a lot of patients are not sure how they know that they have vein disease. It could be multiple things. It could be some restless leg syndrome. It could be swelling in the legs, progresses throughout the day. It could be itching of the legs. You're not sure, you feel like you can get it, but you can't. They could be painful. You could have the bulging veins. Some people say they have quite a bit of aching. Most patients are not aware that varicose vein disease is something, so they don't really know until they either go to the doctor or they hear our ad or something to indicate, oh, well, I have those symptoms, so I should probably call and make an appointment. We have a lot of those patients, and it's really important that you do get checked out, because would you rather go and pay a lot of money to go get something done, surgery-wise, or would you rather pay to have a consult done to see if that's an issue before? A consult consists of coming in. We take your insurance, have you fill out some paperwork so we can get some background, maybe some family history, some symptoms that you may be having in your legs. We bring you in onto our consult room. We get some extra background that we may or may not have. We'll do some ultrasound on your leg. That way we can determine if what you're feeling in your legs is actually something caused by veins. And that's basically what our consult consists of. It's really easy. You're not getting, anything crazy done. It's simple, fast. Usually our consults are an hour long, sometimes less.
My symptoms before I came to vein specialists were I'd have throbbing and pain in my legs at night. I would get tremors or where your legs will quake, and restless leg syndrome, they call it. It was really a relief to get my legs done.
Hi, I'm Dr. Ty Bell with Vein Specialists of Alaska, reminding you that if you have varicose veins, we can help.
It's just a company that you work for that is down to earth. Like there's no drama, and everybody cares about everybody and what they're doing. From the time that we say good morning to each other till the end of the day, we're like, we did good, great job. We have a really good team. All 4 offices, we have a really great team.
What do your patients tell you about Dr. Bell?
They tell me that they enjoy him because he's got a good personality. He's got wonderful bedside manner. That's probably his biggest trait that I've heard yet. And that each patient he talks to, he always brings something home to it. So whether he's got it inside him or their heart or whatever, he definitely connects to them personally.
It's been very pleasing. We've been able to start in Wasilla and expand from there. So Wasilla, Anchorage, Soldotna, and Juneau, where we are today. And it's very pleasing to help a lot of people and try to come to them so they don't have to travel quite so far to see us.
If someone was talking about their legs aching and, some of the symptoms that I had, I would say, you need to go get some laser work done on your legs, because you will feel so much better. And especially if you're awake all night, which makes you tired, then you're not good the next day. So just go get it done.
When they come back and they say that they can get back to doing the things that they love, it's a good feeling knowing that you helped them.
The first person they usually talk to is a lady named Tiffany. She fields most of the calls, and they will be told kind of what to expect. And that is basically they can bring their own shorts, or we supply shorts, and we put them in the shorts and we examine the legs, looking for the telltale signs of venous disease. Sometimes it's very obvious with bumpy, lumpy varicose veins. Other times it's not. They may have hardly any symptoms, but they will turn out to have venous disease in a large number of those cases. But we examine the legs. We take a history, which is more vein specific. We want to know their general medical condition and other problems, as it may affect what we need to do with them. But generally, even people with a lot of medical comorbid conditions, we call it, it doesn't prohibit us from doing what we need to do. But the ultrasound is the most time-consuming part of the visit, and that's really the critical step. The ultrasound, we stand a patient to do that, to really stress the venous system to make sure it's either working properly, or if it's not, to find out where the problems are. And we like the patients to watch. Most patients like to watch, and we explain as we go. And then, of course, after we finish the ultrasound, we like to sit with them, explain in detail, and make sure they understand. And if there's a procedure appropriate, again, it's usually these endovenous thermal ablations, where we heat up the inside of a diseased vein to get rid of it rather than taking it out. The old stripping method was that. And make sure they understand, answer their questions, and so when they show up, they're well informed and usually at ease for the procedure.
Before I came to the vein specialist, my legs were always tired. My ankles were swollen. I mean, you could definitely see it at the end of a long day. And then at night when I lay down to sleep, there was burning and itching in the right leg and left leg. I could never get comfortable or stretch enough.
Dr. Bell is wonderful. I always hug him.
I highly recommend Dr. Bell.
I would definitely recommend Dr. Bell and the Vein Specialist of Alaska.
Most people will comment, and it makes me feel good that their experience with us was much more pleasing than going to the dentist. And that's always pleasant to hear. And generally, the people that do opt for medication, we can do one leg on one particular day. There are reasons for safety of the patient that we don't generally do two leg procedures in one day. But if they take an anxiety medicine the first day, they may come back the next day and say, you know what, I don't need it. It's not near what I thought it was going to be, not near as bad as I thought.
Actually, I was excited to get it over with, because I got tired of looking at those ugly veins on my legs. The procedure was quite comfortable. They sit you down in the room, they have you lay back. They look at your legs and determine what they're going to do. Dr. Bell asks you if you want to listen to some music, and he actually let me listen to my own music, which was cool.
Yeah, tell us about that. Tell us about your music.
Well, I make music as a hobby at home on the side, after work or on the weekends. And it's just something I've been doing for like 10 years. Make music about anything from my native heritage to, like Christian hip-hop, uplifting music like that. For anyone who was experiencing anything like my kind of pain that I was feeling in my legs, I would recommend coming to see Dr. Bell at the Vein Specialist of Alaska.
I was training for a marathon, so I was running quite a bit, like 6 days a week. They would ache, they would swell, there would be like shooting pains sometimes. The doctor has restored some confidence that was not there. I can wear shorts now. If you come here to see these girls and this doctor, you'll have nothing to fear. They'll take that right away.
Hi, I'm Dr. Ty Bell, reminding you that if you suffer from varicose veins, we can help.
We hope you're enjoying this edition of Alaska Health and Fitness Magazine. I'm your host, Tim Baxter, reminding you that if you miss any part of our program, you can catch it online anytime at alaskahealth.net. That's alaskahealth.net. We caught up recently with Dr. John Krelick. He is Alaska's sleep doctor. If someone you know snores, or you've been told that you snore, you need to listen up.
The symptoms of sleep apnea, the major ones are fatigue, tiredness, if there's a history of high blood pressure, diabetes, snoring, of course, and people who are overweight. All these are cardinal symptoms that someone may have this very important medical condition called sleep apnea.
So snoring, I take it, is the key.
Snoring is the key, and frequently all the time, the spouse, the loved one warns the patient about that, although the patient doesn't always believe it.
Because they're not hearing it.
Correct, yeah, middle of the night, asleep, but the wife, the husband will mention it, and they'll bring the patient into me, and usually it's a one-way conversation that, the spouse says, you do snore, and the patient says, no, I don't think I do, and we take it from there. And oftentimes we do find that these people do have significant sleep apnea.
And so people understand, we hear this term a lot, sleep apnea. What exactly is that?
Well, sleep apnea is episodes through the night where a person stops breathing. And some people can stop for as short as 10 seconds, and I've seen people stop for up to a minute and a half without any breathing at all.
Wow.
And as you can imagine, Tim, this can turn into a very dangerous situation because untreated sleep apnea may lead to high blood pressure, heart attacks, strokes, diabetes, and even dying in your sleep, Tim. So it's very important to identify it early and to treat it.
Well, my story is in 2007, I was diagnosed with fibromyalgia, and I was living a very painful life, and the doctors put me on heavy medication, very weight-gaining medications. And in 2010, I went to a specialist, and he said, I would have never treated you for fibromyalgia, I would have treated you for a sleep disorder. So I got off the medications, lost almost 50 pounds from that, and still had a little bit of trouble, but I was feeling a lot better. Now, Ron and I are going to be married for 21 years this June. So since we've been married, we kept thinking, well, maybe a little bit more snoring because we're getting a little heavier. I had kids. Ron's been in his job for 20 years. And so perhaps he started snoring a little louder and a little louder, much to the point where when we go on vacation, my family, we actually had to isolate him in my brother's piano room.
Wow.
Because nobody could be near him, and I could certainly not sleep. Wow. So these years have been going by, and we kept seeing Dr. Kralick's commercial. We decided to make the call. And so they pieced him first because they diagnosed him with the apnea. And see, he's an operator for the city. He needs to be alert every moment of his 10 to whatever hour shift.
Right.
And therefore, I noticed a huge difference in the way he is in the morning. He turned into a morning person.
How long till I knew that I had sleep apnea? It was one of those things where you'd go to bed, sleep 7, 8, 9 hours, wake up exhausted. I'd stop moving at any time, sit on the couch or at my desk for any length of time. If I stopped, I'd doze off. In fact, the time I knew I was really in trouble is that I was live on the air, went to a commercial break, dozed off, woke up after 2 minutes of dead air and realized we might have a problem. Go see Dr. Kralick.
Over the past maybe half a decade, home sleep testing is now available. And home sleep testing has pretty much replaced in-lab testing. The home sleep testing is a small device that the patient takes home himself, hooks it up himself, and in the comfort of his own bedroom is analyzed. He brings it back to us in the morning, and we analyze the data, and most of the time we're able to make the diagnosis of sleep apnea.
Definitely, the comforts of my own home helped out a lot. I know there's many companies here in town that does the same kind of practice, but it was a little bit different where you can actually go to be at home, be around, and in a comfortable surrounding where you can try to fall asleep. The home side of taking that test by Dr. Kralick was just so much more easier and convenient for myself. I'm a busy person. If I'm not at work, I'm doing something that has to do with work. If I'm not doing something at work, I'm doing something with family. So that convenience part was huge to me and my family. And just the test in general, coming back, providing that information for them, it was just as easy as being at an office, sleeping at some random bed in the back, and it's a lot cheaper.
Most of the time, people just need to come in. We'll educate them how to use this simple home sleep test. Or, Tim, if they're off the grid, if they're living in a remote Alaskan village, we're able to mail that to them. And then with my staff, we'll be able to talk to them over the phone, how to apply it, and then they mail it back to us, and then we analyze it and make the diagnosis. And Tim, once we make the diagnosis, then we're on to the treatment plan.
Driving, I used to drive shuttle bus, and while I was driving, you know, sometimes I would doze off while driving, and that is dangerous. And so I heard a commercial, and it was talking about this sleep doctor. And after listening to the commercial, I was inspired to call the number and speak with someone to get me help. The first night I used the machine, woke up on time, ready to work with so much energy, and it felt great.
For being married almost 21 years, we have our own list of ailments, from his stomach and my sleep disorder and his snoring. And one of the things that we both shared is when we're not sleeping, we are not happy. And when we're not happy, when we wake up to face the day, we have 2 boys, 2 teenage boys, we got to get them to school, and it's not easy when you're so fatigued. It's like you're walking around with a cloud over you. And this really, you're energized because you had a good night's sleep.
If someone has sleep apnea, they're at higher risk of developing high blood pressure, heart attacks, strokes, diabetes, mood disorders. And likewise, if someone has any of these conditions, they're at higher risk of having sleep apnea. So it's important to get it diagnosed and treated.
The results, of all of it is I'm more awake, I'm active, I'm awake again, and I'm sleeping better, which is really, really nice. My wife likes to say that it saved our marriage before it even occurred, which is one of my favorite parts, is that, she was so afraid that I was going to die. It was one of those really hard things for her. Now she's like, well, saved her, I can sleep next to you now. That's perfect. It's best.
If someone you love snores, I know you're talking to them about it. Now you need to come and talk to me about it, because that snoring may be an indicator of a more serious condition.
And the snorer generally isn't aware of it.
Absolutely. The snorer, I would almost say, is never aware of it. And they're argumentative when they come that they don't snore. It's and again, it's something out of the movies that is funny, except in real life it's not funny, and it can indicate a serious medical condition. Visit us at alaskasleepdoctor.com or give us a call.
If you or your sleep partner snores, Dr. John Krellick has some exciting news for you. For a limited time only, get a free sleep apnea screening. Free! You may even be able to do it on the phone.
I feel great. When I wake up every single day, it's like a new day.
Hi, I'm Dr. John Krellick, Alaska Sleep Doctor. If you or a loved one snores, don't put off the evaluation.
This is a pretty serious thing, and you should really get it taken care of. It can cause you a lot of problems, especially if you wait too long and you decide to work on it later in life. All the staff is so professional, friendly. They really make you feel at home. I've told many people about coming to Vein Specialists of Alaska, and I'm going to continue to tell people about the great job that they did for me. I would highly recommend the people, if they're having these issues, please come to see them. They're the best.
My symptoms were I could not sleep at night. My legs were constantly hurting me really bad. They were swelling up. The people are friendly. The people treat you good, and you feel like you are among friends, not in a doctor's office, which is normally very sterile.
Call my dad at Vein Specialists of Alaska.
I'm a professional magician based out of Anchorage. In the summertime, I'm extremely busy. I'm on my feet probably at least 16 hours a day. I noticed last summer that my legs were really giving me a problem, as well as my feet. After work, it would be so unbearable, the pain, that I'd have to put my feet up.
When they come back and they say that they can get back to doing the things that they love, it's a good feeling knowing that you helped them.
Vein Specialists of Alaska is the company that you should go to get your varicose veins treated. They take very good care of you. If you have any questions, they'll make you feel at home. Dr. Bell has a great bedside manner, and they always talk about how hilarious he is. They talk very highly of him.
Can't talk enough about Dr. Bell. He's awesome. He made you feel at ease immediately.
I love my dad, and you will too. Call today.
If you or your sleep partner snores, Dr. John Krellick has some exciting news for you. For a limited time only, get a free sleep apnea screening. Free! You may even be able to do it on the phone.
If you or your sleep partner snores, don't wait another day. Call Dr. Krellick now.
Call him now. Give me a call or visit us at alaskasleepdoctor.com.
How long till I knew that I had sleep apnea? You know, it was one of those things where you'd go to bed, sleep 7, 8, 9 hours, wake up exhausted. I'd stop moving at any time, sit on the couch or at my desk for any length of time. If I stopped, I'd doze off. In fact, the time I knew I was really in trouble is that I was live on the air, went to a commercial break, dozed off, woke up after 2 minutes of dead air and realized we might have a problem. Go see Dr. Krellick.
Life is good since I've been using the APAP. Sleep well every night. I wake up rested. I no longer have restless legs. Other benefits that I found, I've been losing weight.
Hi, I'm Dr. Krellick, Alaska Sleep Doctor. Sleep apnea is a serious disease. Testing and treatment can now be done in the comfort of your own home. Visit us at alaskasleepdoctor.com or give us a call.
I was experiencing couldn't walk for the way I'd walk for exercise. Just felt tired all the time, and found out that it was because the blood wasn't getting back to my heart the way it should. And Dr. Bell said that was a pretty easy fix, and that I shouldn't hesitate to get it done. And I'm awfully glad I did, because it has made all the difference in the world.
If you or your sleep partner snores, Dr. John Krellick has some exciting news for you. For a limited time only, get a free sleep apnea screening. Free! You may even be able to do it on the phone.
And if you want better sleep, if you want a better life, I suggest that people would just take the test.
Give me a call or visit us at alaskasleepdoctor.com.
Well, we hope you've enjoyed this edition of Alaska Health and Fitness Magazine. Our visit with Dr. John Krellick, Alaska's sleep doctor, and earlier in the program, Dr. Ty Bell with Vein Specialists of Alaska. If you'd like information about either of these practices, just get online to alaskahealth.net. That's alaskahealth.net. And if you're a healthcare provider and would like more information about being a part of a future program of ours, all you have to do is email us at the address on your screen. Send us an email. We'll be in touch. We'd love to hear from you. Thanks so much for joining us. We'll see you next time on another edition of Alaska Health and Fitness Magazine.